How does respiratory inductance plethysmography work with continuous positive airway pressure machines? Have you ever wondered how technology helps us understand our breathing during sleep? One fascinating tool used in sleep studies is called respiratory inductance plethysmography, often shortened to RIP. This method is essential for monitoring breathing patterns, especially for those dealing with sleep apnea. So, how does it work? Respiratory inductance plethysmography involves placing elastic bands around the chest and abdomen. These bands contain sensors that detect the expansion and contraction of your body as you breathe. When you inhale and exhale, these movements create electrical signals that reflected your breathing effort. In sleep studies, this information is vital. It helps identify episodes where breathing may be reduced or even stops altogether, known as apneas or hypopneas. By analyzing the data from RIP, specialists can differentiate between obstructive sleep apnea, where airflow is blocked but breathing effort continues, and central sleep apnea, where the effort itself is diminished or absent. Now, let's connect this to continuous positive airway pressure machines, commonly referred to as CPAP machines. These devices deliver pressurized air through a mask to keep the airway open during sleep. When a patient uses a CPAP machine, respiratory inductance plethysmography can be utilized to evaluate how well the CPAP is performing its job. As the patient sleeps with the CPAP machine, the RIP sensors continue to track their breathing effort and the movements of their chest and abdomen. If the CPAP is working effectively, the data collected will show normalized breathing patterns without interruptions. However, if apnea events still occur, the information from RIP can help clinicians make necessary adjustments to the CPAP pressure settings. Practically speaking, this means that respiratory inductance plethysmography provides real-time feedback on how well a patient is breathing while using a CPAP machine. Sleep specialists can then tailor the therapy to meet the individual needs of the patient. RIP is often part of a comprehensive sleep study, known as polysomnography, conducted in sleep labs. Some home sleep apnea testing devices also incorporate RIP along with other sensors to monitor breathing, oxygen levels, and respiratory effort. In essence, respiratory inductance plethysmography works alongside CPAP machines by monitoring breathing effort during sleep. This collaboration helps detect apnea events and assess the effectiveness of CPAP therapy in maintaining open airways and normal breathing throughout the night. The integration of these technologies supports accurate diagnosis and personalized treatment for sleep apnea, ultimately improving the quality of life for those affected.